Today, we're going to talk about something that might seem completely harmless, but according to recent research, could be affecting your stroke risk, and that's the use of sleeping pills and certain nighttime medications. Now, I want to be clear right from the start. We're not talking about occasional use here and there. The research suggests that regular, long-term use of certain sleep medications, particularly a class called benzodiazepines and some older antihistamines, may be associated with increased stroke risk in adults over 50. Before you panic if you're currently taking sleep medication, let me walk you through what the evidence actually shows, what the limitations of that research are, and what practical steps you can take to sleep better while minimizing potential risks. I've spent considerable time reviewing the published studies on this topic, and I want to give you a balanced, honest picture of what we know and what remains uncertain. Before we dive in, I need to give you the standard but important disclaimer. This is educational content, not medical advice. It doesn't replace talking to your healthcare provider about your specific situation. Everyone's health circumstances are different, so any changes to your medications or sleep routine should be discussed with your doctor, especially if you have existing conditions or take other medications. Never stop taking prescribed medications without consulting your healthcare provider first, because stopping some medications abruptly can be dangerous. Let me start by explaining how sleep medications work and why this connection to stroke risk might exist. Most prescription sleep medications work by affecting neurotransmitters in your brain, those chemical messengers that help control sleep and wakefulness. Benzodiazepines, which include medications like temazepam and triazolam, work by enhancing the effect of a neurotransmitter called GABA, which has a calming effect on the brain. The newer sleep medications, often called Z-drugs, like Zolpidem, work in a similar way, but on slightly different receptors. Then there are over-the-counter sleep aids, many of which contain diphenhydramine or doxylamine, which are antihistamines that make you drowsy as a side effect. Here's what changes as we age that makes this relevant to you. As you get older, your body processes medications differently. Your liver and kidneys, which are responsible for breaking down and eliminating drugs, become less efficient. This means medications can stay in your system longer and can accumulate to higher levels than they would in a younger person. Your brain also becomes more sensitive to many medications, including sleep aids. Additionally, older adults are more likely to be taking multiple medications, which increases the chance of drug interactions. On top of all this, your blood vessels change with age. They become less flexible, a process called arterial stiffening, and you're more likely to develop conditions like high blood pressure and atherosclerosis, which is the buildup of plaque in your arteries. These age-related vascular changes are already risk factors for stroke, so anything that might add to that risk becomes more significant. Now let's talk about what the research actually shows. A large study published in the British Medical Journal in 2022 examined this question directly. The researchers analyzed health records from over 400,000 adults aged 50 and older in France. They looked at people who were prescribed benzodiazepines or Z-drugs and tracked their health outcomes over an average of 6 years. What they found was that people who used these medications regularly, defined as filling prescriptions for more than 90 days per year, had approximately a 28% higher risk of stroke compared to people who didn't use these medications. That sounds alarming, but let me put it in context. We're talking about an increase in relative risk, not absolute risk. For someone with an already low stroke risk, a 28% increase might still mean their overall risk remains relatively low. For someone who already has multiple risk factors, like high blood pressure, diabetes, and a history of heart disease, that same relative increase could be more concerning. Now, this study had some important limitations we need to discuss. First, it was an observational study, which means the researchers watched what happened naturally rather than assigning people randomly to take sleep medications or not. This design can show associations, but it can't prove that the sleep medications directly cause the strokes. It's possible that people who need sleep medications also have other health issues or lifestyle factors that contribute to stroke risk. The researchers did try to control for known factors like blood pressure, diabetes, and smoking, but there could always be other factors they didn't measure or account for. Second, The study was done in France, and prescription patterns and healthcare systems differ around the world, so we have to be careful about applying these findings universally. Third, the study looked at prescription records, which tell us what was prescribed, but not necessarily whether people actually took the medications as directed. Another study published in the journal Neurology in 2023 looked specifically at antihistamine sleep aids, the kind you can buy over the counter. This study followed about 90,000 adults over the age of 65 for 5 years. The researchers found that people who regularly use diphenhydramine, that's the active ingredient in many over-the-counter sleep aids, had about a 15% higher risk of stroke compared to non-users. Again, this was an observational study with similar limitations. Interestingly, the researchers also found that these medications were associated with poorer sleep quality over time, which means people were taking them to sleep better, but actually ending up sleeping worse. This is because your body can develop tolerance to these medications, meaning you need more to get the same effect. And when you do sleep, the sleep architecture, the natural pattern of sleep stages, can be disrupted. A meta-analysis published in The Lancet Neurology in 2021 pooled data from multiple studies and looked at the overall pattern. This analysis included data from over 2 million participants across 12 different studies. The conclusion was that long-term use of sedative hypnotic medications, that's the category that includes benzodiazepines and Z drugs, was associated with a modest but statistically significant increase in stroke risk. The analysis estimated about a 20 to 30% increase in relative risk for long-term users. The researchers noted substantial variation between studies, which suggests that individual factors, medication types, and dosages all play important roles. They also emphasized that the absolute risk increase for most individuals was relatively small, but given how many people use these medications, the public health impact could be significant. Let me explain some of the proposed mechanisms for why this association might exist, because understanding the why helps us think about solutions. One theory is that these medications can affect blood pressure. Some sleep medications can cause blood pressure to drop when you stand up, called orthostatic hypotension, but they might also affect your blood pressure during sleep in ways that could contribute to vascular damage over time. Another possibility is that these medications affect the quality of your sleep in ways that increase cardiovascular risk. Deep sleep is important for cardiovascular recovery and blood pressure regulation. If medications disrupt your natural sleep architecture, you might not be getting the restorative sleep your cardiovascular system needs. A third theory involves something called the anticholinergic effect. Many sleep medications, particularly the over-the-counter antihistamines, block a neurotransmitter called acetylcholine. There's growing evidence that medications with strong anticholinergic effects may contribute to cardiovascular problems and cognitive decline over time. Finally, some researchers have suggested that the medications themselves might not be the problem, but rather the underlying sleep disorders they're treating. People with severe insomnia or sleep apnea have higher stroke risk, so the association we're seeing might partly reflect the underlying condition rather than the medication. It's also worth noting that not all sleep medications show the same level of risk in the research. The strongest associations have been seen with benzodiazepines and first-generation antihistamines. Newer medications like melatonin receptor agonists or low-dose doxepin, which works differently than typical antihistamines at the low doses used for sleep, have less evidence of stroke risk, though they also have less long-term research overall. This doesn't mean they're necessarily safer, just that we have less data. Melatonin supplements, which are widely used and available without prescription, haven't shown stroke risk in studies so far, but the research on long-term melatonin use is still limited, and the quality and dosing of over-the-counter melatonin products can be inconsistent. So, what does all this mean for you practically? If you're currently taking sleep medication regularly, the first and most important step is to talk with your doctor before making any changes. Some sleep medications, particularly benzodiazepines, can cause withdrawal symptoms if stopped abruptly, including rebound insomnia that's worse than your original sleep problem. Your doctor can help you develop a safe tapering plan if discontinuing or reducing medication is appropriate for your situation. They can also evaluate whether the medication is still necessary or whether there might be better alternatives. Sometimes people continue taking sleep medications out of habit long after the original reason for starting them has resolved. If you and your doctor decide to reduce or discontinue sleep medication, there are evidence-based, non-medication approaches that can be very effective. The gold standard is something called cognitive behavioral therapy for insomnia, or CBTI. This is a structured program that addresses the thoughts and behaviors that interfere with sleep. Research shows that CBTI is as effective as medication for treating chronic insomnia, and unlike medication, the benefits tend to persist long-term even after you complete the program. CBTI typically involves several components. There's sleep restriction, which sounds counterintuitive, but involves temporarily limiting your time in bed to match your actual sleep time, then gradually increasing it. There's stimulus control, which means using your bed only for sleep and sex, not for watching TV or scrolling on your phone. There's cognitive restructuring, which involves identifying and changing unhelpful thoughts about sleep, like catastrophizing about the consequences of a bad night's sleep. Many people can access CBTI through their healthcare provider, and there are also online programs and apps that deliver CBTI effectively. Beyond formal CBTI, there are several sleep hygiene practices that can make a meaningful difference. Let's talk about what actually works based on the evidence. First, maintain a consistent sleep schedule. Going to bed and waking up at roughly the same time every day, even on weekends, helps regulate your body's internal clock. Your body likes predictability. Second, get exposure to bright light during the day, especially in the morning. This helps reinforce your circadian rhythm, your internal 24-hour clock. If you can spend time outside in natural light, that's ideal, but even sitting near a bright window can help. Third, limit light exposure in the evening, particularly blue light from screens. If you use devices in the evening, consider using blue light filters or wearing blue light blocking glasses. The research on blue light glasses is mixed, but they seem to help some people, and there's minimal downside to trying them. Temperature matters more than most people realize. Your body temperature naturally drops when you sleep, and a cool bedroom facilitates this. Most sleep researchers recommend a bedroom temperature between 60 and 67 degrees Fahrenheit, though individual preferences vary. Some people find that warming their feet with socks helps them sleep, which seems contradictory, but warming your extremities actually helps heat dissipate from your core, lowering your overall body temperature. Exercise can improve sleep quality, but timing matters. Regular physical activity is associated with better sleep, but vigorous exercise close to bedtime can be stimulating for some people. If evening exercise disrupts your sleep, try shifting workouts to morning or afternoon. For others, evening exercise doesn't cause problems. Pay attention to how your body responds. Let's talk about caffeine, because this is an area where many people underestimate the impact. Caffeine has a half-life of about 5 to 6 hours, which means if you have a cup of coffee at 3 in the afternoon, about half of that caffeine is still in your system at 9 p.m. If you're having trouble sleeping, try cutting off caffeine by early afternoon or eliminating it entirely for a couple of weeks to see if it makes a difference. Remember that caffeine is in tea, chocolate, some sodas, and some medications, not just coffee. Alcohol is another important factor. While alcohol might help you fall asleep initially, it disrupts sleep architecture, particularly the second half of the night. You might wake up frequently or wake up too early and not be able to get back to sleep. Many people find their sleep quality improves significantly when they reduce or eliminate alcohol, especially drinking within a few hours of bedtime. There are some supplements and natural approaches that have at least some research support. Magnesium is involved in sleep regulation, and some studies suggest that magnesium supplementation might help with sleep quality, particularly if you're deficient. Typical doses used in research are around 200 to 400 milligrams of magnesium glycinate or citrate taken in the evening. Magnesium can cause digestive upset in some people, so start with a lower dose. Talk to your doctor before starting magnesium supplements, especially if you have kidney problems or take certain medications. Melatonin can be helpful for some sleep issues, particularly for adjusting to new time zones or for circadian rhythm disorders. For general insomnia, the evidence is more mixed. If you try melatonin, use a lower dose than you might think. Many over-the-counter products contain 3 to 10 milligrams, but research suggests that lower doses, around zero point 0.5 to 1 milligram, might be just as effective with fewer next-day side effects. Take it about 1 to 2 hours before your desired bedtime. Quality matters with melatonin supplements because they're not tightly regulated. Look for products that have been tested by third-party organizations. Some people find herbal teas like chamomile or valerian helpful. The research evidence for these is modest, but they're generally safe, and the ritual of having a calming warm beverage before bed might have its own benefit independent of the herbs themselves. If something helps you relax and signals to your body that it's time to wind down, that has value even if the chemical compounds in the tea aren't doing much directly. This touches on an important point about the placebo effect in sleep. The placebo effect is quite strong for sleep interventions, which isn't a bad thing. If you believe something will help you sleep and it does help you sleep, even if the mechanism is primarily psychological, you're still sleeping better. The goal is better sleep, not proving a particular mechanism. Relaxation techniques can be remarkably effective. Progressive muscle relaxation involves systematically tensing and then releasing different muscle groups, which can help release physical tension that interferes with sleep. Deep breathing exercises activate your parasympathetic nervous system, your body's relaxation response. A simple technique is 4-7-8 breathing, where you breathe in for a count of 4, hold for 7, and breathe out for 8. Repeat this 4 or 5 times. Meditation and mindfulness practices have good research support for improving sleep quality. There are many apps and online resources that offer guided meditations specifically designed for sleep. The key with all these techniques is consistency. They work better when practiced regularly, not just pulled out occasionally when you're desperately trying to fall asleep. Now, if you have underlying sleep disorders, those need to be addressed directly. Sleep apnea, where your breathing repeatedly stops and starts during sleep, is common in adults over 50 and significantly increases stroke risk on its own. If you snore loudly, wake up gasping for air, or feel exhausted despite spending adequate time in bed, talk to your doctor about a sleep study. Treating sleep apnea, usually with a CPAP machine or other interventions, can dramatically improve both sleep quality and cardiovascular health. Restless leg syndrome, periodic limb movement disorder, and other sleep disorders can all interfere with sleep and may need specific treatment. Sometimes what looks like insomnia is actually an underlying sleep disorder that requires a different approach than sleep medications. It's worth mentioning that sometimes medical conditions or other medications affect sleep. Pain, whether from arthritis, neuropathy, or other conditions, is a major sleep disruptor. Addressing the underlying pain may improve sleep more than any sleep medication would. Some medications for other conditions can interfere with sleep. Beta blockers, some antidepressants, corticosteroids, and decongestants can all affect sleep. If you started a medication around the time your sleep problems began, mention that to your doctor. Sometimes switching to a different medication in the same class or adjusting the timing of when you take it can make a difference. I want to address something important about expectations. As we age, sleep naturally changes to some degree. Older adults typically take a bit longer to fall asleep, spend less time in deep sleep, and wake up more frequently during the night compared to younger adults. This doesn't necessarily mean something is wrong. If you're waking up once or twice during the night, but falling back asleep fairly easily and feeling reasonably rested during the day, you might not need intervention. The goal isn't to sleep exactly like you did when you were 30. The goal is to get enough quality sleep to function well and feel reasonably rested. Many older adults do fine with 7 hours of sleep instead of 8. Some need more than 8. Individual needs vary considerably. There's also something called sleep anxiety that can develop, where you worry so much about not sleeping that the worry itself keeps you awake. If you've had insomnia for a while, you might have developed negative associations with your bedroom or bedtime. This is where the cognitive component of CBTI really helps. Challenging catastrophic thoughts about sleep, like believing that one bad night will ruin your whole week, can reduce the anxiety that perpetuates insomnia. Sometimes the best thing you can do when you can't sleep is to get up, go to another room, and do something calm and boring until you feel sleepy. Lying in bed, frustrated and watching the clock usually makes things worse. Let me be clear about when you should seek medical attention. If you're experiencing symptoms that could indicate a stroke or transient ischemic attack, that's a medical emergency. These symptoms include sudden numbness or weakness, especially on one side of the body, sudden confusion or trouble speaking, sudden vision problems, sudden severe headache with no known cause, or sudden trouble walking or loss of balance. Don't wait to see if these symptoms resolve. Call emergency services immediately. The faster stroke is treated, the better the outcomes. If you're having difficulty sleeping along with chest pain, severe shortness of breath, or irregular heartbeat, those are reasons to seek prompt medical evaluation. If you've been taking sleep medications regularly for months or years and want to stop, do this under medical supervision. Your doctor can create a safe tapering schedule and monitor for any problems. If your insomnia is severe and persistent despite trying non-medication approaches, it's worth seeing a sleep specialist. Sometimes there are underlying issues that need professional evaluation. Let me bring all of this together for you. The research suggests that long-term regular use of certain sleep medications, particularly benzodiazepines and antihistamine-based sleep aids, may be associated with a modestly increased stroke risk in adults over 50. The evidence isn't definitive because most of it comes from observational studies, but the pattern across multiple studies is consistent enough to take seriously. The absolute increase in risk for most individuals is relatively small, but given that stroke can be devastating and that there are effective alternatives to medication for treating insomnia, it makes sense to minimize unnecessary medication use when possible. This doesn't mean everyone taking sleep medication needs to stop immediately. It means having an informed conversation with your healthcare provider about whether you still need the medication, whether there might be safer alternatives, and what non-medication approaches you could try. The evidence-based non-medication approaches, particularly cognitive behavioral therapy for insomnia, are genuinely effective. They take more effort than swallowing a pill, but they address the underlying causes of insomnia rather than just suppressing the symptom. They don't carry the potential risks that medications do, and the benefits tend to last long-term. Good sleep hygiene, addressing underlying sleep disorders, managing conditions that interfere with sleep like pain or sleep apnea, and using relaxation techniques can all contribute to better sleep. Some supplements like magnesium and melatonin may help in specific situations, though the evidence is more limited and quality varies. Remember that individual results vary considerably. What works beautifully for one person might not work for another. Sleep is influenced by your genetics, your health conditions, your medications, your stress levels, your environment, and numerous other factors. It's worth trying different approaches systematically to find what works for you. Give each approach a fair trial, usually at least 2 weeks, before deciding it doesn't help. Keep in mind that sleep often improves gradually rather than overnight when you make lifestyle changes. Also remember that perfection isn't the goal. You'll still have occasional bad nights, and that's completely normal. The goal is overall better sleep quality most of the time, not perfect sleep every single night. The relationship between sleep and cardiovascular health goes both ways. Poor sleep increases cardiovascular risk, but cardiovascular disease can also disrupt sleep. Taking care of your overall cardiovascular health, managing blood pressure and cholesterol, staying physically active, eating a healthy diet, and not smoking all contribute to both better sleep and lower stroke risk. This is all interconnected. Similarly, managing stress and mental health matters for both sleep and cardiovascular health. Chronic stress and depression are linked to both insomnia and increased cardiovascular risk, so addressing these issues helps on multiple fronts. If you found this information helpful, I'd appreciate it if you'd subscribe to the channel. It helps me continue creating evidence-based health content for adults over 50. Sharing this video with someone who might benefit from it helps spread accurate information about sleep and cardiovascular health. If you have questions about this topic or suggestions for future videos, leave them in the comments. I do read them and try to address common questions in upcoming content. I want to emphasize again that this is educational content, not medical advice. Your specific health situation is unique, and decisions about medications and sleep treatment should be made in consultation with your healthcare provider who knows your complete medical history. Thanks for watching, and here's to better, healthier sleep.